Hello everyone, my name is Rafael Martinez and I am a pharmacy student. Today I'm going to discuss the basic care that needs to be administered to an injured person before emergency medical help arrives, also known as first aid, for an infant who is found unconscious and not breathing, with a special emphasis on infant CPR. Many people do not think pharmacists or pharmacy students would have to learn how to administer first aid, but in reality, any component of a professional healthcare team must know how to administer basic first aid, CPR, and know how to use an AED. And for all laymen in the audience, it is also necessary to know how to administer first aid to help others. The National Center for Injury Prevention and Control, a department within the CDC, reported that unintentional injuries are the 5th leading cause of death for all Americans and the leading cause of death for younger individuals ages 1 to 34. In short, in order to preserve lives during emergency situations, one should be trained and certified in how basic first aid should be administered. First, the person who initially responds to the scene, also known as a first responder, must make sure the environment is safe enough to approach. It is important you do not put yourself in harm's way. 911 should then be contacted. If you are alone, then you must contact emergency services yourself. If there is another uninjured party who is present, they should be dispatched. Some may question this move, but I assure you it is necessary to call 911 before administering first aid. If not, and you begin administering first aid, how can you ensure that any emergency medical service has been contacted or is on their way? Second, the first responder must assess the state that the injured person is in. The first state to be assessed is consciousness. Is the injured person conscious or unconscious? Next, determine if the person is an infant, a child, or an adult. Assessing these factors will determine how you respond to each individual situation. If the injured person is unconscious and unresponsive to repeated touching and prompting, then the ABCs must be assessed. A stands for airway, B stands for breathing, and C stands for check pulse. One must check to see if the airway is obstructed or unobstructed, if the injured person is breathing, and if they have a pulse. If the injured person is unconscious but breathing, try to rub the knuckles brusquely against the victim's sternum, the column that separates the breasts. If the injured person does not awaken or wakes up and is confused or unable to speak, it should be ensured that the person be given immediate medical attention and 911 be contacted. If the unconscious injured person is not breathing, it is necessary to begin chest compressions. Chest compressions stimulate the heart to begin beating and pump blood through the body, promoting oxygenation of the blood to help prevent further organ, tissue, and brain damage. To begin compressions for an adult, the heel of your hand is placed in the middle of the chest with your other over the hand on the chest interlaced. The chest should be compressed at least 2 inches to ensure that the heart is being reached. The chest should completely recoil before the next compression and should be compressed at a rate of at least 100 compressions per minute to mimic the beat of the heart. If you do not have CPR certification, continue to do chest compressions until medical help arrives or the victim regains consciousness. CPR is a very taxing procedure that can easily tire the first responder. If another person is present and you are comfortable, you can switch places to prevent fatigue. I repeat, if you are not properly trained in CPR, please do not attempt rescue breathing, since improper administration of CPR can cause further harm to both the uninjured person and even the first responder. For infants, chest compressions are done differently, because obviously infant bodies are much more fragile and vulnerable to damage when compared with the child's or adult's body. Just like the adult body, when finding an injured infant, the first thing to do is assess the level of consciousness. Smaller infants respond well to having the soles of their feet rubbed or tapped, while babies older than 2 months old should be tapped on the shoulder or chest. In both cases, call the baby's name out loudly. Do not hurt the baby, but it is necessary to be aggressive before administering life-saving procedures. If the infant does not wake up, either have someone else call 911 or call 911 yourself. If the baby is not breathing, you must begin chest compressions by placing 2 fingers on the breastbone directly between the baby's nipples. Push your fingers straight down about 1.5 inches or about 1/3 of the thickness of the baby's chest and allow the chest to completely recoil. Complete this step 30 times, 2 times per second. If you have been trained in CPR and know how to give rescue breaths, you may give them. But if not trained, wait for emergency medical service to arrive. As I said before, infants are even more fragile than children and adults, and giving them proper rescue breaths can cause their lungs to burst. If the infant is still not breathing and emergency services have not arrived, continue chest compressions either until medical help arrives or the infant wakes up. I will now demonstrate to you how to perform CPR on an infant. Baby, 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 call 911. Baby's not breathing. Begin chest compression. 10, 11, 12, and that's how you perform CPR on an infant. In conclusion, I would like to reiterate the most important points. For all categories of injured persons, the procedures are uniform. Assessment of both the external environment for safety and the level of unconsciousness must be determined. If the injured person is not breathing, then emergency services such as 911 must be contacted before chest compressions can start. Chest compressions differ based on age, and infants should be handled firmly but gently, as opposed to children and adults who can be handled more strenuously. And it must be repeated and stressed. If you are not trained in CPR or do not remember how to administer CPR, do not give rescue breaths, because you could possibly further injure the injured person or yourself. Please remember, by knowing these few skills, you can help save a life. Are there any questions? Okay then, my name is Rafael Martinez, and I thank you all for listening so attentively.